Every day we are exposed to a variety of things in our daily environment. At home we are exposed to things like what we watch on television and to various elements of the weather depending on where we live. Depending on the type of work we do, we also can be exposed to a variety of hazards. Some occupations are very hazardous. Some have minimal hazards. You are receiving this training because you likely work in an environment where you may be at risk of coming into contact with infectious materials, like blood or other body fluids. You can be exposed through a number of ways, including touching contaminated instruments or equipment, by handling soil laundry, or by handling waste generated by treating patients. Pathogens can enter your body through your mouth, eyes, nose, a cut or an abrasion, or other mucous membranes.
It is a common practice for healthcare facilities to follow standard precautions, a higher level of precautions. Universal and standard precautions are in compliance with OSHA's standard. By using universal or standard precautions, you are defending yourself against exposure to bloodborne pathogens. OSHA intended for universal precautions to make the risk of acquiring bloodborne-related injuries, illnesses, and diseases as remote as possible. Standard precautions increase protection further by applying the requirement to even more body fluids, simply increasing the level of precaution.
In some healthcare settings, you may need to use respiratory protection in the form of an N95 disposable particulate respirator to filter out very tiny respiratory pathogens that are airborne transmitted. With proper fit, an N95 respirator is 95% effective against tuberculosis. You may be fit tested for this type of respirator. To protect yourself against larger respiratory droplets, wear a surgical mask whenever you are within 3 feet of an infected person. Surgical masks offer some protection against diseases such as strep throat, bacterial meningitis, flu, diphtheria, pneumonia, and parvovirus B19. A surgical mask is worn only one time and then thrown away.